Stop diabetic heart damage now. Part 1. The molecular battlefield. The chemistry of heart decay. The war on your heart doesn't start with a chest pain. It starts with a single molecule of glucose. In this segment, we explore the biochemistry of endothelial dysfunction. Your arteries are lined with a delicate, one-cell thick layer called the endothelium. In a healthy body, this layer produces nitric oxide to keep vessels flexible. However, in a diabetic state, the sandpaper effect of high glucose destroys nitric oxide production. We dive deep into oxidative stress. When blood sugar stays elevated, your body produces free radicals, unstable molecules that literally rust your heart cells from the inside out. We also discuss the RAGE pathway receptor for advanced glycation and buildup. This is a biological lock-and-key mechanism where sugar-coated proteins bind to heart tissue, causing permanent stiffening. If you have type 2 diabetes, your heart has to pump against stiff pipes, leading to left ventricular hypertrophy, an enlarged, inefficient heart. Understanding this molecular reality is the first step to stopping the clock. Shutterstock. Explore. Beyond the structural stiffening, high glucose levels disrupt the calcium signaling required for every single heartbeat, leading to electrical chaos and an increased risk of arrhythmias. This environment also triggers mitophagy, where the heart's cellular power plants are destroyed faster than they can be replaced, leaving the muscle chronically fatigued. Part 2. The silent predator recognizing non-classical symptoms. In the USA, diabetic patients are often referred to as the silent population because their symptoms do not mirror the movies. Because of autonomic neuropathy, the nerves that carry pain signals from the heart to the brain are often frayed or destroyed. This leads to silent myocardial. We break down the diabetic symptom profile. Instead of sharp pain, look for dyspnea on exertion, shortness of breath during simple tasks like folding laundry. We explain orthostatic hypotension, feeling dizzy when you stand up, which can be an early sign that your heart's electrical wiring is failing due to sugar damage. We cite the American College of Cardiology, explaining why diabetics often mistake a heart attack for indigestion or flu-like fatigue. We teach the viewer how to perform a self-check. If your resting heart rate has increased by 10 to 15 beats over the last year, your heart is struggling to keep up. The complexity of the diabetic heart means symptoms can manifest in ways that seem entirely unrelated to the chest, beyond simple fatigue. Look for paroxysmal nocturnal dyspnea, waking up suddenly in the middle of the night, feeling as though you are suffocating, which suggests fluid is backing up into the lungs because the left ventricle is failing to pump efficiently. Part 3. The Nutritional Fortress. Reversing the plaque. Dietary advice for diabetics is often focused on weight, but we focus on vascular longevity. We introduce the Mediterranean hybrid diet. We explore the role of phytosterols and polyphenols. We explain the science of HDL, good cholesterol quality. In diabetics, HDL is often small and dense, meaning it's useless at cleaning your arteries. We show how consuming sulforaphane found in broccoli activates the NRF2 pathway, a natural self-defense system that protects the heart from sugar-induced inflammation. We also address the sodium-glucose link. Sugar makes your kidneys hold on to salt, which increases blood volume and puts massive hydrostatic pressure on your heart. By switching to a high potassium, low sodium diet, you effectively depressurize your cardiovascular system. We provide a 3-day meal blueprint focused on vascular elasticity. The Nutritional Fortress is built on more than just macronutrients. It requires specific bioactive compounds to heal the molecular scarring discussed in Part 1. Phytosterols, found in seeds and unrefined oils, compete with cholesterol for absorption, while polyphenols found in dark berries and green tea act as direct vasodilators, signaling the arteries to relax and expand. Part 4. The kinetic reset exercise as a biological pump. Exercise is not about burning calories. It is about mitochondrial biogenesis. In this section, we explain how the diabetic heart loses its power plant's mitochondria. We introduce the 10-minute postprandial walk. Science shows that walking for just 10 minutes immediately after a meal mops up excess glucose before it can scar your heart. We dive into high-intensity interval training, HIIT, versus low-intensity steady state. For the diabetic heart, we recommend a base-building phase. We explain the muscle-heart crosstalk. When your muscles contract, they release myokines hormones that signal the heart to repair itself. This is biological engineering. We discuss the AHA guidelines of 150 minutes of moderate activity. But we break it down into activity snacks for the busy American professional, ensuring that the heart never sits in stale blood for more than 2 hours. The American Heart Association recommends 150 minutes of moderate activity per week. But for the diabetic, how you distribute those minutes is more important than the total sum. We advocate for activity snacks. When you sit for prolonged periods, blood tends to pool in the lower extremities, and your vascular system becomes stagnant. Part 5. The longevity protocol, sleep, stress, and testing. The final pillar is the psychoneuroimmunology of the heart. Stress is not just a feeling. It is a chemical flood of cortisol and adrenaline. For a diabetic, stress-induced cortisol causes the liver to dump stored sugar into the blood, creating a phantom spike that damages the heart even if you haven't eaten. We explore the sleep apnea connection, a massive hidden killer in the USA diabetic community. We provide a Know Your Numbers clinical checklist. This isn't just a 1C, it's your CAC score, calcium score, which is a CT scan that shows exactly how much stone plaque is in your heart. We discuss the role of SGLT2 inhibitors and GLP-1 agonist, new classes of medications that the American Diabetes Association now recommends specifically for heart protection, regardless of sugar levels. We conclude with a message of empowerment. The heart has a remarkable ability to remodel if you provide the right environment. To truly stop the clock, you must move beyond the standard A1C test. A1C is a 3-month average, but it doesn't show the structural reality of your arteries. To get a clear picture of your molecular battlefield, you need specialized diagnostics. I have a question for you. Which of these 5 steps are you going to start today? Is it the 10-minute walk or the Mediterranean diet? Let me know in the comments. I read every single one of them. Stay healthy, and I'll see you in the next video.